Hi guys, how are you? I'm Dr. Olga Shvab. Welcome to my channel. I'm preparing my saffron tea and it's nice to drink it. It's one of my beauty recipes in this chilly weather. It's all the day long, it's raining, heavy rain, and I've got inspired today to talk to you about so demanded topic about RADIESSE, our luxury procedure, how to get it without complications and risks. So there are a lot of myths and gossips. People talk sometimes opposite opinions. Some specialists, they tell, do this, it's easy, it's beautiful results, no side effect. Others, they tell, stop doing this, don't do this, it's dangerous, you will see a lot of complications. Actually, where is the truth? As always, somewhere in between. It's not good to make it with a fanatism, with a lot of product, without considering other features. So we have to do everything consciously. We need to understand what is RADIESSE and how to deal with this. And the most important, to be professional and to be correct with our technique. Because, you know, you can draw this as a picture with beautiful technique, and then it will look nice and people will enjoy it. And then you can draw this without any technique and then it will look awful. Everything depends on our skill, on the quality of procedure. As better we skilled, as more we do combination, we have options and we are more successful. But let's talk in details. So people just want collagen stimulation and fillers. They worry about complications. I think actually complications, this is the most important thing for both specialists and clients. And by the way, don't feel shy, don't be afraid of making comments here under this video, because here we are all great community of doctors and aesthetic specialists and also clients and also people who just interested in this procedure. So we talk honestly and you guys can easily ask your questions and you can give your suggestions and opinions and you can share with us your experience, good, bad and so on. Just make a comment and we will discuss it together. So let's talk about RADIESSE. Why people so much worry about this? And is it really dangerous? This is number one question. I don't think so, you know. First of all, let me introduce. I'm Dr. Olga Shvab. I'm expert, international trainer. I do a lot of master classes across the globe, and specialist people, even plastic surgeons and dermatologists and other specialists from aesthetic field, they come to me, they meet with me, they invite me for individual trainings to correct their technique, for group master classes and so on. And I have a fantastic experience with even with this product, and I used to work as an expert since 2012 until 2017 in Russia, when I used to live in Russia as an expert for Merz company, and I used to make some studies, to participate in some studies, and I did my studies well with my clients, meso-radius with chemical peels together in one procedure, and then we did ultrasound. We saw collagen formation in the group where were combination of chemical peels and meso-radius. It's well studied, I would say, and it's not more dangerous than other fillers as hyaluronic acids or other. We consider RADIESSE as a biodegradable product because it's going out from the body during officially during 12 months, 1 year, and according to my practicing, sometimes it's more like 1.5 years, but then it's simply going away. And it's easily proven by MRI scans. For example, you see here the scan before injecting, then straight after procedure. You see this product is visible here as the white areas, and then you see after 1 year it's just residue of the product in the tissues, and a new injection, and you see again product is here. So everything you want to control, you can make ultrasound or you can make MRI scans, and it could be proven. All the other information is just gossips and myths and so on. But of course we have to be conscious with the products anyway, without doing a big amount, without fanatism. We always need to make it correctly. We need a special education, especially with radiesse, because it's quite different from all other fillers. Sometimes we can mistaken with dilution, because there are a lot of different information how to dilute it for different areas. That's why the right masterclass is required. And when you do this correctly, it's not dangerous. I mean, we consider RADIESSE as a collagen stimulator. We always think that to stimulate collagen, this is something good, but in fact we need to understand what is this process. When we inject something into the skin, any collagen stimulator, and then the body is reacting on this product, then we get a septic inflammation, and then as a reaction of this inflammation, in fact we have collagen, new formation in the skin. Sometimes it's more, sometimes it's less, more high dense fibrosis or just mild fibrosis. It depends on the intensity of this inflammation. And if we compare RADIESSE and poly-lactic acids, for example, RADIESSE for me looks more luxury, mild stimulation, gentle stimulation. That's why I don't recommend to mix RADIESSE with something else in one syringe to stimulate more. We simply doesn't need it. It's already enough what we have inside of RADIESSE. And also you can use RADIESSE as a normal filler. You can inject RADIESSE as a boluses, and you can get shape, you can get volume, lifting for your face, and you can see very good, beautiful results. If you talk about RADIESSE initially, what is this? This is hydrogen hydroxyapatite, actually 30%, and 70%. What is this? This is carboxymethylcellulose gel, gel carrier, and then when you worry about complications, just think logically. If it's embolization, if it's just vascular occlusion, you can affect on this problem locally with also hyaluronic, like for hyaluronic acid filler, for example, you use Hyalase. Hyalase, something like BP serum total corrector, and then you will see that 70% of the product is melting immediately. But even with this Hyalase, you can affect on the whole product. I never saw problem with this. Actually, in all my during all my career, I saw just couple of cases with vascular complication with RADIESSE. Both of them was manageable, nothing serious, without any consequences. And if you worry about bumpiness sometimes due to more superficial injection, that's also not a problem. It's very simple to fix it. You just inject saline in this bumpiness, then you massage it. This is information actually for specialists. If you're a client and after procedure you see some bumpiness on the neck, like white spots, then you can come to your injector. Just don't panic, because it's easy to correct it. Then your specialist just inject this saline, then massage it. Sometimes also it's possible to use PP serum total corrector, and then it will be completely solved. And don't worry about this at all. But if you will compare, this with other collagen stimulators, complications, for example, with SCULPTRA or some other poly-lactic acids, you can see that it's more complicated to manage some bumpiness, because it's not a product inside the skin, it's mostly high dense fibrosis. due to severe inflammation, and then the body tries to get rid of this product. It's like it's simple to understand this. If you imagine plastic bottles, you don't want to drink from plastic bottles, but somehow you agree to inject plastic into your skin. So it's a kind of plastic, and then anyway the body could react on this after some weeks or some months, even some years, and then you will face to this complication. It will be more difficult to manage this. So Radiesse, in my opinion, much more smoother, these procedures easier and friendly in the tissues, and not so much complicated because this biodegradable product. We also can consider it like semi-permanent because it's longer lasting than hyaluronic acids, for example, but anyway it's degradable. This is for us good information to know. And if you talk about what else can happen, what kind of complications, it's so-called aesthetic complications could happen with all the other products as well, with hyaluron and other products, when you don't consider, or injector don't consider proportions and do just as they think, that here sometimes they see more features, more volume, bigger jawline. In some people it doesn't look good. So for this, to prevent this, I recommend to specialists to use golden ratio tool for their procedures, to measure angles, profile angles, to measure some linear proportions and distances. And we know that golden ratio exists in nature everywhere actually, and all beautiful things we see around, and also golden ratio is very common to use in beautiful pictures. Artists use it for to make beautiful features, portraits, to point some kind of beautiness and so on. So we use golden ratio tools to measure proportions, to see the apex of the cheeks, to see how long should be the jawline, and how high should be the cheekbones, and how curvy should be temples and forehead. And we, if we can consider this in our procedures, then you will be more safe with these results, and you will be always satisfied. Actually, I never saw that people tell that they have too big cheeks, big features, or not nice jawline after correction with Radiesse and hyaluron, if we use these golden ratio guidelines. And by the way, if you're a specialist and you would like to book these tools and a masterclass about these tools, you can approach me through the website, or here just comment under this video and my assistant will send you the information. So and one more about complication, one more thing, and then we will finish with the complications. Just I wanted to tell you guys, get rid of your fears. Maybe it sounds easy, but it's not really difficult if you understand that if you are scared too much about something, it will come into your life, because this is how actually universe works. If you're afraid too much, then you will face with this until you will stop being afraid. You attracted more and more if you afraid so much. So how to get rid of fears? Just one suggestion, guys. You need to correct your technique, you need to upgrade your technique, you need to practice, you need to learn, and then every step you do, you will feel more confident, you will be more satisfied with your results, and your clients will be happy. And that's it about complications. It's not more than from other fillers, I mean, and let's talk more about beautiful results. Why do I like Radiesse to use it in my practice for my clients? Because, you know, Radiesse gives very define shape, and it's actually important for men and for women who wants to see defined shape. With fillers, with hyaluronic acid, it's always a problem to maintain well-defined results after procedure. First you see the definition, the shape, and then it's become smoother, softer and melting with times. Not because something was done wrong, it depends on initial features. If you had poor shape of the jawline, it's more difficult to build it with small amount and with hyaluronic acids, and it needs more time and more procedures, and it needs combinations as well with radius. Radius actually helps to maintain well-defined shape after fillers. Simply you can do this combination. You can inject radius as a boluses for jawline and cheekbones for well-defined features, and then in between you can inject something like hyaluronic acids with cannula actually, or you can do this actually with radius, with cannulas as well as a vector technique. But with radius as a vector technique, you need to wait more until the result will come, because collagen stimulation and lifting with this technique needs time. And look to this client in this model. We did it easily in one procedure. Look, first we injected the cheekbones with boluses techniques. You need to make it correctly again. It needs a special technique. We do this not like with hyaluron, but anyway, you see we did these boluses, and then we did the jawline and the chin. We got nice shape and the client was happy. But you see in between the area is still empty and loose skin, and we wanted more lifting, and the client also mentioned that she wants more lifting. You can do straight away this combination with Mona Lisa Soft, for example, or you can use other fillers as Dermal Lift, for example, and you do this in another direction differently. With hyaluron you do this to the platysmal auricular fascia to lift it, and then you see with the cannula, just few injections, you see straight away nice lifting and good smooth skin and beautiful looking face, lifted, slimmer. She looks less tired, happier, and for sure 10 years minimal 10 years younger, and happy after procedure. This is what I like with combinations radius and hyaluron. It's not dangerous, you can do this easily, but the only situation that all the trauma you do in one time, and don't do this like hyaluron you did today and radius you do tomorrow. No, you do this in one procedure, or you do this with the gap minimal 21 day. And if you have more experience how to combine different products, how to get better results, then you will feel safe and more confident every time you do every new step. So let me invite you to our group and individual trainings. You can approach me through our website and settle your date for the training. So I think the only one way to grow in this direction with radius, this is to upgrade, to work with your technique, and then you will see that you are happy and your clients also happy. This is great to feel comfortable, powerful and independent. And I'm by your side. I always can help you with this because I know this product from A to Z. I know all the combinations, all the possible combinations, and I have my author's protocols, and it's my pleasure to share these effective protocols with you. What is actually better, radius or Sculptra, poly-lactic acid or polycaprolactone? How to choose from collagen stimulators? You know, guys, I would stick to biodegradable product anyway, because permanent products as polylactic acid and polycaprolactone, they are quite unpredictable. We cannot predict how they will behave with time, in a few months, in few years, when probably your body will get sick or the immune system will go down. It could be some kind of reactions. It could be granulomas, and there are no guarantees, and there are no long-lasting studies about this. That's why I see that radius, it's more gentle in their skin. It's more friendly in the tissues. There are no granulomas. I never saw granulomas actually. Please let me know in the comments if you saw something bad with radius. The maximal I saw, as I told you, were some bumpiness, white bumpiness, but not from after a long time after procedure as a granuloma. It's just straight after procedure due to incorrect, poor technique, when specialists they injected so much superficially. And we already discussed this. This is just my thoughts that radius, it's better to choose from other collagen stimulators in terms of safety and stunning results without overgrowing fibrosis, and the skin will look better, smoother. And it's interesting then that with radius the result is coming day after day, in few weeks, after 2 months, the result is better and better, lifting is more and more obvious, and this is what people love actually with this. And I never saw that somebody don't like the result with radius. The only thing that it could takes time for some people, this collagen stimulation, and due to radius mild stimulation, it's probably necessary to maintain it, to make 2 or 3 procedures per year. Of course, it's better not to overdose. It's never good to overdose. I always tell about you. But if you would like to try collagen stimulators, better you try radius in a small amount first. Just one syringe. I just suggest to all my new clients. I have good experience with radius. Despite that, I start with one syringe mostly. Sometimes if I want to build the shape, obvious shape, I do 2 syringes, one per side, mostly for bone injection, just to get more shape and more defined features. It's possible, but you need to know the history of your client, and if you are a client, you need to know your body reaction. And if you have tend to allergic reactions or immune reactions, you better start from the small amount. This is actually my expert suggestions for you if you want to try radius. Don't be afraid too much, but be conscious with the amount, and of course you need to choose the right injector who will not mistake with technique and with the with proportions and the overall results, shape, and so on. So great to see you guys. See you soon in the next video. Have a great day, everyone. Thank you for being with me. It's always a pleasure to talk to you. Please give me your opinions about radius in the comments if you have this experience, or if you had good or bad experience, or what questions, what is in your mind. And I will answer for sure on these questions in the next video. See you soon, guys. Subscribe. Bye bye.